Hello, I am Dr. Rajorshi Datta, consultant internal medicine at Bhagirathi Neotia Hospital, and I would be talking about a very important issue, that is hypertension. Hypertension means blood pressure that is more than normal. There are two components of blood pressure, systolic and diastolic, and they are usually mentioned as suppose say 110 by 70, and we need to be careful about both these components. A normal blood pressure for most adults is that the upper component or systolic should be less than 140 and the lower should be less than 90. Ideally, however, the upper component should be less than 130. Previously, it was considered a disease of the middle ages and elderly, but in the current Indian population, due to lifestyle changes and diet, we are seeing people suffering from hypertension even in the early 20s, if not in teenage years. So we should be aware of this problem. Blood pressure, particularly in patients who have a strong family history or suggestive lifestyle, should be checked very regularly and steps taken early on to correct it. If hypertension is not corrected, then there are end organ damages like your heart, kidney, brain, everything can be affected, and you can have a stroke, you can have kidney failure, you can have heart failure, a heart attack if the hypertension remains uncorrected for a long time. To prevent hypertension is actually more important than treating it, particularly for younger adults. So lifestyle modification is very important. All tobacco use should be banned, rather not done. Government is not banning it. We should not take any tobacco in any form. Everyone should partake in regular physical exercise and have a healthy diet, not too much of saturated fat or fried foods, and check the blood pressure regularly, ideally by a professional, so that hypertension can be diagnosed and treated early. If treated early, then these complications can be avoided. There are many medicines for hypertension, and contrary to popular belief, most of them do not have any side effects and can be taken safely for lifelong. So do not be afraid of treating hypertension. Get your medicines, blood pressure checked, follow a healthy lifestyle, and take doctor's advice if needed as soon as possible. Thank you.